Apicon 2024 highlights Part 3 Epilepsy. The conditions which may be mistaken for epilepsy are syncope, which include cardiac, postural, vascular, cough, and micturition, vascular causes like TIA, TGA, drop attacks, migraine, sleep disorders like cataplexy, parasomnias, sleep myoclonus, somnambulism, microsleeps, drugs, metabolic causes like hypoglycemia, drugs, withdrawal states. Other neurological disorders like tonic spasms, hyperexplexia, psychiatric disorders like non-epileptic attacks, panic disorder, anxiety state. Seizures versus epilepsy. A seizure is a transient symptom of abnormal, excessive, or synchronous neuronal activity in the brain. Epilepsy is if there are two or more unprovoked seizures and the seizure should be more than 24 hours apart. Status epilepticus is considered a single seizure. Febrile and neonatal seizures should be excluded. Recurrent provoked seizures is not epilepsy. According to this epilepsy is considered resolved for individuals who either had an age-dependent epilepsy syndrome but are now past the applicable age or have remained seizure-free for the last 10 years and off anti-seizure medication for at least 5 years. Is it a provoked seizure? If there is a CNS insult like stroke, CNS infection, or head injury, there is more than 10% recurrence risk. If there is a systemic insult like hypoglycemia and hypocalcemia, toxins, or even fever, there is less than 3% recurrence risk. The interval of the seizure from the precipitating factor. If it is a stroke, a head trauma, or a cerebral anoxia precipitating the seizure, the time of occurrence is after 1 week, within 1 week. Cerebral infections at the time of positive clinical and lab findings. If there is a brain abscess, a cerebral tuberculoma, it's during treatment. For HIV infection, it's during an acute infection or a metabolic disturbance. For an AV malformation, it occurs at the time of acute hemorrhage. Multiple sclerosis, it occurs within 7 days of relapse. In autoimmune diseases, it occurs during signs and symptoms of activation. Predictors of relapse of a first unprovoked seizure. The etiology and the EEG. If it's idiopathic and there is a normal EEG, there's 24% recurrence rate. If it's idiopathic and abnormal EEG, it's 48% relapse. If there are symptoms plus a normal EEG, it's 48%. And if there are remaining symptoms and an abnormal EEG, it's 65% relapse. Bulla versus a cyst. The first one is a bulla, the second is a cyst, and the third is a cavity. The differences between cavity, bulla, bleb, cyst, and pneumatocoel. A cavity, by definition, is a thick or thin-walled abnormal gas-filled space in the lung. Fluid level may be present. It's usually thick-walled, more than 3 millimeters, and it's within the pulmonary parenchyma. The bulla is a focal region of an emphysema. There is no discernible wall because less than 1 millimeter. It's more than 1 or 2 centimeters in diameter, up to 75% of the lung, and it arises from the second pulmonary lobule. A bleb is a small, subpleural, thin-walled air-containing space adjacent to the visceral pleura. Walls are usually less than 1 millimeter thick, and it's less than 1 to 2 centimeters in diameter. It's within the visceral pleura. A cyst is a round, thin-walled, low attenuation spaces, and it may contain air or fluid. It's thin-walled up to 2 millimeters in diameter, and it's inside the lung parenchyma or the mediastinum. A pneumatocyst is intrapulmonary gas-filled cystic spaces, and it's thin-walled, less than 1 millimeter. The radiological characteristics of cavity lesions. You should see the wall thickness, the characteristics of the inner contour, internal content, the number, the location, and other findings. Wall thickness. Cavities with a wall thickness of 4 millimeters or less were usually caused by non malignant processes. If the wall thickness is between 5 and 15 millimeters, it's mixed, malignant and non malignant causes. Wall thickness of more than 15 millimeters is usually malignant. Thick walled versus thin walled. Thick walled, you have lesions like lung abscesses, pulmonary tuberculosis, necrotizing small cell carcinoma, Wegener's granulomatosis, and blastomycosis. Thin walled cavities would be open negative tuberculosis, Mycobacterium consusii infection, metastatic carcinoma, coccidiomycosis, congenital or acquired bullae. The classification of cavitary lesions are congenital, as in bronchogenic pulmonary cyst, traumatic, as in pneumococcal, infective, as in bacterial, tubercular, fungal, and parasitic, neoplastic, systemic causes like Wegener's, rheumatoid arthritis, pulmonary infarction, and septic emboli. Metastatic, there would be multiple and large in size like cannonball appearance. Differing sizes, thick and irregular walls are seen in adenocarcinomas. Thin wall cavities are seen in squamous cell carcinomas. Cavitation is more common in upper lobes than in the lower lobes. These are cannonball lesions. Fungal infections. The most common is aspergillus. There are cavitary lesions of variable wall thickness. In aspergillosis, there are thick walls, isolated or multiple, in the upper lobes associated with focal opacities and diffuse infiltrates.
The triangular valve-shaped area and septic emboli, which you can see again the cavitating nodules. And organizing pneumonia, you can see the multiple ground glass appearances, sometimes from air bronchovan sign, and parasitic hydatid cyst. Again, there is the air meniscus sign and so many other signs, air Katzen signs. Hydatid is also sometimes single or sometimes multiple. And pneumocystis carinii also can present usually in HIV infection like this. The sign is called the meniscus sign, usually you have seen. Similarly, fungal wall. So this is the cavity and wall inside. This is the wall inside. This is the wall inside. So you will find the fungal wall. Similarly, in supine and prone position, you can see thus the wall remain the same. So what is this air crescent sign is a very important sign, and you must know the differentials, because the differential of air crescent sign can be, most common is the aspergillosis, no doubt, but it can be lung abscess, it can be bronchogenic carcinoma, it can be TB cavity with resonance,